Hello and welcome back to my channel. My today's topic is scleritis. It is an inflammation of the sclera proper and it is a comparatively serious disease which may causes the visual impairment and even loss of eye. Scleritis, it is an incidence is much less than the episcleritis. It is usually occurs in elderly people of 42 to 70 years involving females and comparative to the males. Then etiology of scleritis, in that some common conditions such as the autoimmune collagen disease such as the Wegener's granulomatosis, polyarthritis nodosa, etc. Then the second is metabolic disorder like gout and thyrotoxicosis, some infections such as the herpes zoster ophthalmicus, and then granulomatous disease. After that, surgical induced scleritis, then miscellaneous conditions such as the irradiation, chemical burns. Then after that and last, it is the idiopathic causes which is unknown. Then pathology of scleritis, in that the histopathological changes over the chronic granulomatous disorder characterized by the fibrinoid necrosis and destruction of collagen together with infiltration by the PMNS, that is the polymorphonuclear cells and lymphocytes, plasma cells and macrophages, etc. Then comes classification of the scleritis. First is the immune mediated non-infectious scleritis and the second is the infectious scleritis. Immune mediated non-infectious scleritis, it is two types. First is anterior scleritis which is occurs in 98%. Anterior scleritis, it is two types. First is non-necrotizing scleritis which occurs in 85% condition, and necrotizing scleritis, it is occurs in 13% cases. Then the other part is the posterior scleritis which occurs only 2% cases. Then the clinical features. In clinical features, symptoms are the pain, redness, may be localized or diffused, photophobia and lacrimation may be mild to moderate. The lastly is the diminution of the vision may occurs occasionally. Then complications occurs. First is the sclerosing keratitis and the keratolysis, complicated cataract, and lastly the secondary glaucoma may occurs. After that we see investigation. In investigation we see the DLC, TLC and ESR, serum level of the complement and immune complexes, serum uric acid for gout, then the urine analysis, Montauk's test, X-ray of chest, paranasal sinuses, then lastly the sacroiliac joint and orbit to rule out the foreign body, especially in the patient with the nodular scleritis. Lastly, the treatment of scleritis. In the treatment of non-infectious scleritis, we give the topical steroid eye drop, systemic indomethacin 75 mg twice a day, then oral steroids, topical steroids, then the immunosuppressive agents such as the methotrexate and cyclophosphamide, subconjunctival steroid which are contraindicated. Lastly, the surgical treatment which is in the form of the scleral patch graft may be required to preserve the integrity of the globe. Then you can use the mnemonic TSOTISS to learn this treatment. Treatment for infectious scleritis is given antimicrobial therapy both with the topical and oral agents. Second is the surgical debridement. It is found useful by the debulking the infected scleral tissue and also facilitating the effect of antibiotics.